Now let's talk about diagnosis according to Qi, Shui, and Jinyi imbalances. Blood deficiency, or Shui Shu. When there are blood imbalances, there will be observable disturbances in one or more of the functions performed by blood in the body. It will either be because there is too little blood to perform the function, like blood deficiency, or because blood has stagnated and therefore cannot fulfill its functions. Stagnations of blood will also prevent the free passage of qi, blood, and jinye, and this will often result in pain. Blood can also become too hot, and there can be a physical loss of blood through bleeding. As we saw with Qi deficiency, there can be a general condition of blood deficiency with accompanying signs and symptoms, as well as a blood deficiency condition in specific organs, liver blood deficiency and heart blood deficiency. The main function of blood is to nourish and moisten the tissues of the body and to nourish and anchor Shen. This means that when there is a condition of blood deficiency, any of the following signs and symptoms can be experienced. The skin, especially the skin in the face, can be pale, sallow, and dry. This is due to a lack of moisture and nourishment. Shen is anchored and thereby circulates together with blood. Blood deficiency can therefore also result in the complexion lacking luster and radiance. The lack of nourishment and moisture can also manifest with dry hair, ridged or brittle or soft fingernails, pale and dry lips. The hair can also be very fine and there can be a tendency to lose hair due to the hair roots lacking nourishment. Dizziness is often seen when there is blood deficiency, especially when the person gets up from a sitting or lying position. The dizziness arises because the brain lacks nourishment. The brain's lack of nourishment can also manifest as a poor memory. This is, for example, a common complaint of women whilst they breastfeed their baby. The breast milk is produced from blood, so there are often blood deficiency as a consequence. When there's blood deficiency, there can be insufficient blood to nourish extremities. Shen is anchored by blood and thereby circulates together with blood. The lack of blood in the extremities can therefore result in numbness, sensory disturbance, and tingling sensations in the extremities. There can also be muscle cramps in the legs in the evenings when blood returns to the liver. The eyes are nourished by liver blood. A person who is blood deficient can have poor vision, especially at night, difficulty focusing their eyes when they are tired, spots in front of the eyes, and the sensitivity to bright light. Women who are blood deficient will often have scanty menstrual bleeding or even amenorrhea. If there is heart blood deficiency, there can be palpitations as well as insomnia, anxiety, or a sense of unease and nervousness. This is because Shen is not being anchored and nourished by blood. The tongue will be pale, thin, and dry because it is not saturated by blood. The pulse will be fine or choppy. There are three main causes of blood deficiency. There may be an inadequate intake of food that creates blood, and there may be a deficiency condition in one or more of the blood producing organs, such as the spleen or kidneys, or there may be loss of blood through bleeding or because it is consumed by mental or physical overactivity. The symptoms and signs are pale or sallow complexion, dry skin, dry and pale lips, dry hair, hair loss, fine thin hair, numbness, tingling sensations of sensory disturbance in the arms and legs, and dizziness. There's also poor memory, visual disturbances, spots in the visual field, night blindness, difficulty focusing the vision, sensitivity to bright light, rigid, soft, or brittle fingernails, palpitations, insomnia, nervousness or anxiety, scanty or absent menstrual bleeding, thin, pale, and dry tongue, fine or choppy pulse. The key symptoms: pale, sallow complexion, dry skin, scanty menstrual bleeding, dizziness, fine and choppy pulse. The treatment principle is to nourish the blood. The acupuncture points to choose from are stomach 36, spleen 3, spleen 6, Ren 4, Ren 12, urinary bladder 17, UB20, and UB21. The needling technique to be used is tonifying, and moxa is recommended and should be used on UB17. So UB17 nourishes blood. Stomach 36, spleen 3, spleen 6, Ren 12, UB20, and UB21 tonify the spleen and thereby the production of blood. Ren4 nourishes Jing and thereby blood. For relevant advice, it is important that a person who is blood deficient eats a diet that is rich in foods that nourish blood, such as red meat, chicken, liver, green leafy vegetables, beetroot, seaweed, dates, nettles, aduki beans, kidney beans, and black beans. Furthermore, they should eat a diet that tonifies spleen qi. Blood deficiency can be caused by the following patterns of imbalance, like blood loss and spleen qi deficiency. And it can result in spleen qi deficiency, blood stagnation, and yin deficiency. Thank you for your attention.